So would I offer this to a family member? Absolutely.
I would too. Absolutely. Tomorrow. Hi, I'm Simona Cuevas, and I practice aesthetic dentistry in San Antonio, Texas.
Hey everyone, my name is Volker. I'm a general dentist in Sunnyside, Queens, New York. I'm a big advocate for minimally invasive dentistry and the use of composite resin for these types of treatments.
I personally was asked to come and see the course and evaluate it for Reality Now.
I've known Thomas Seeley for quite some time. We've been together in some of the online groups. And then I said he was going to be doing a course in the United States. He said, would I be interested in seeing it? And I said, absolutely. Whatever he's doing, I would absolutely love to see. He's one of my favorite clinicians, so it was pretty much a no-brainer.
Me personally, I thought, oh, another flowable technique that everybody's doing that's not going to last, that's not going to work, that's not taking occlusion in consideration, it's not taking the amount of how long it's going to last in terms of years into consideration. It's a quick fix, and I'm not really quite interested. But then seeing the online presentations that you guys give that's preparatory to this course, it totally changed my mind.
Yeah, I think Simona said it best. It was really, I was expecting not a fly-by-night because I know you guys would never be involved with something like that, but I was a little bit skeptical. So I really came here trying to seek some more knowledge about the procedure and the protocols. What that does is that really sets you up, gets you primed, so that when you come in, you're really ready to address the hands-on portion of it. So I think as a concept, it's a really great thing.
I agree 100%. It is very modern the way it's done. The speakers are great. The information is great. And I'm not just saying that. I was looking at it very critically to start off. And by the time I was done with all the modules, I was sold on this concept, this novel concept that can change the course of modern dentistry. Flow was great. It went back in detail on everything that was touched on online, and it explained every procedure and every part of the procedure exactly. It gave you the science behind it, and it gave you information on how to do it with a hands-on portion, which I think will help anybody just freehanding a composite better leaving this course rather than even not just implementing it.
Absolutely. I found the flow to be really great. I really appreciate as an educator the fact that they took such a good didactic approach backed by literature, and then we had a really in-depth information during the hands-on portion, and really allowed us to get, dentistry being such a tactile field, it really gave us a good way to interact with the materials and get a better, definitely a much better understanding of the technique and protocol.
I consider myself pretty okay at doing freehand composites, and some of the tricks that were shown to us today as to how to sculpt the facial surface of anterior composites and how to give them a true lifelike appearance, I think was great, was novel to me. So I definitely leave here having learned a lot.
Did I pick up anything? Absolutely. I mean, we're very fortunate in that we had 3 excellent lecturers.
Correct.
Gave us, again, it's just that detailed information, and the exercises were really geared towards setting you sequentially up to completing something like a SmileFast technique. So yeah, I mean, it was really great in terms of what we can able to pick up. Do I think that composite would be a first-line treatment? Yes, and especially in a technique like this, I think what SmileFast may be able to do is fill that niche for those patients who are perhaps in some type of transition, maybe some type of transitional dentition, or they're not yet ready for, or maybe never need indirect or ceramic restoration. So I think there's really a place for it, definitely in terms of the scope of dental treatment available.
And the fact that we can offer this for patients at a much lower price point than we would porcelain veneers. It fills in that gap that right now the flowable techniques that's out there are trying to fill but don't deliver on a long-lasting result, versus this is actually giving proper dentistry, offering proper dentistry for the patient for something that would last longer than any type of flowable material, and with the understanding that they're either going to have to redo it in about 5 years time, or upgrade to veneers, porcelain veneers, when they can. So it's either a step up for somebody to look good till they make more money, or a final result for somebody who just might be happy with that.
Yeah, I would say, would I be comfortable offering something like SmileFast to a family member? I would say absolutely. The beauty of this technique is that it's minimally invasive, and it's pretty much for the most part additive. And in those cases, I mean, it can work so phenomenally well. And you see the results that are out there, and I love the materials that they've chosen because, as Simona said, those flowable techniques that you see, yeah, they may hold up, but then we worry about long-term polish. I mean, what we're using here typically are nano-hybrid composites, much stronger, and they can maintain their polish usually better. So would I offer this to a family member? Absolutely.
I would too. Absolutely. Tomorrow. I would. I think it is the way of the future. I definitely think it's something that, if nothing else, this course in itself prepares you and gives you a better understanding of occlusion, anatomy, secondary, tertiary anatomy in the anterior dentition, how to preserve that and how to work with the tissue parallel to that. A lot of things that in some courses, because they're just so streamlined, are being left behind.
Would I recommend this course to someone else? Absolutely, because there's so much knowledge to be gained here, and even outside of the technique itself. What we learned today, like Simona said, about anatomy, what we learned about polishing, what we learned about application. I mean, that in itself had value, but if you can add that to what was done with the SmileFast technique, I mean, it's absolutely, I think, a course you don't want to miss it. You're going to get, if you miss it now, you're going to regret it.
Yeah, and it's one of those courses that truly, whenever we go to, as dentists, I speak from my own experience, whenever I go to a CE course, I want to leave that place knowing that the next day when I go to the office on Monday morning, I can actually implement that technique, and it's going to make me a better dentist, it's going to make my patients happier, and it's going to bring me more money. I mean, that's basically what we're all after in this for. And with all the stuff that we learned here, I think it will definitely change the way I practice going Monday morning.